approximately 6.5 million individuals in the U.S. are living with Alzheimer's disease and other forms of dementia. As the population ages, the prevalence of these conditions continues to rise. For professional caregivers and aging services professionals, understanding Alzheimer's and implementing best practices for person-centered care is crucial. Welcome to the Comfort Connections podcast. In today's episode, Professional Caregivers Insight, What is Alzheimer's Disease? We are joined by Dr. Heather McKay, an occupational therapist and dementia care specialist at Partnerships for Health.
Here's what I'll share with you today. I want to look at some of the science behind Alzheimer's disease, some hallmarks of the condition, like what to look for and what makes Alzheimer's disease distinct from all the other types of dementia. We'll also examine the journey of Alzheimer's disease, and what I mean by that is how it progresses over time. Then I'll share some helpful home care strategies that have worked for families and professionals to create days that are more meaningful, safe, and pleasant for people living with Alzheimer's disease and their caregivers. Keep in mind, helpful strategies will include things to try and things to avoid. Imagine you're sitting with a friend at her kitchen table, talking about dementia caregiving. After all, over 16 million Americans are helping a family or friend living with dementia. In fact, the majority of dementia care is done unpaid by family and friends. I wouldn't be surprised if your friend asked, "What's the difference between dementia and Alzheimer's disease?" It's a common question that I answer in presentations, consultations, and these kitchen table talks every week. Let me share a quick explanation that I use that really gets heads nodding. Dementia is an umbrella term, and my arms automatically go up when I explain that. It means that dementia is a category of diseases. With dementia written way up high, there are many different types of dementia underneath the umbrella. Here's what really gets heads nodding. When I say dementia's a word like cancer. Most people understand that cancer is an umbrella term. Whether they say it like that or not, they know that cancer's the word written way up high on the umbrella, and there are many different types of cancer underneath. Like most people know about skin cancer, lung cancer, breast cancer, colon cancer. It goes down the line. They also know that skin cancer is different from lung cancer, but they're both cancer. Well, that's the way dementia vocabulary works too. With dementia written way up high, underneath that umbrella, we've got different types: Alzheimer's disease, vascular dementia, Lewy body dementia, frontal temporal lobe dementia, and the list goes on. Alzheimer's disease is different from vascular dementia, but they're both dementia. Well, don't be surprised if at the kitchen table your friend says, "Thank you. You're the first one to explain the words in a way that's easy to understand and remember." So now you can zero in on that number one most common type of dementia, Alzheimer's disease, and share some more information. People often ask me, "Heather, how does this disease work?" Well, if we look at some science behind Alzheimer's disease, we got to begin in the brain. Your brain is made of approximately 100 billion nerve cells called neurons. Neurons gather and transmit electrochemical signals. You can think about them tossing and catching messages to help you think, feel, move, and function in everyday life. Alzheimer's disease disrupts that process, vital to neurons and their networks, including how they communicate, how they metabolize fuel, how they repair themselves. In Alzheimer's, brain damage is widespread as many neurons stop functioning and lose connections with other neurons that gradually wither and die. While the brain typically shrinks slightly as a result of healthy aging, a brain with Alzheimer's disease loses a significantly greater number of neurons, causing it to shrink to 1/3 of its original size by the end of the disease. Over time, as more and more neurons wither and die, the person with Alzheimer's disease experiences memory loss, confusion, changes in personality, and gradual loss of independence. At first, Alzheimer's disease typically hits neurons and their connections in parts of the brain involved in memory, and then later in areas responsible for language, reasoning, social behavior. Gradually, people need more help in every aspect of life. Scientists are chasing every lead. Genes, environment, lifestyles, and overall health probably all play roles. There's no cure or disease-altering treatment yet. Your friend may say, well, Mom takes a medicine for her brain, and yeah, many people take medicine who have Alzheimer's disease. Some of it actually helps. Talk to the doctor if you notice a medication is not helping or causing problems or risky side effects. But currently, all the medications prescribed to people with Alzheimer's disease are intended to treat symptoms and optimize brain function as it is. So far, we're still waiting for a treatment that would actually alter the course of the disease. In the absence of a cure, millions of healthcare providers and family caregivers focus on treatment, on maximizing skills and abilities in every stage, and enhancing quality of life for everybody involved. Let's name a few hallmark signs or characteristics of Alzheimer's disease, because your friend at the kitchen table may be wondering how to recognize signs of Alzheimer's. First, Alzheimer's disease usually affects people older than 65. It's thought of as a disease of older age. Well, now your friend may say, I've heard of younger people getting it, and they'd be half right. A relatively small number of people have a different type of Alzheimer's called younger onset Alzheimer's disease, which actually starts in one's 30s or 40s. Now, that's a whole different type of dementia. So let's put that aside for now. Not to get it confused, younger onset Alzheimer's disease is its own type of dementia, different from the most common Alzheimer's disease affecting older people. The order of change or path of Alzheimer's disease is fairly predictable. Often, a first noticeable change is in short-term memory. At first, people with Alzheimer's disease have only minimal memory loss and confusion, but Alzheimer's is progressive. So over time, these symptoms intensify. People living with Alzheimer's disease on average for approximately 8 to 12 years after the symptoms appear. But progression may be quicker or slower for individuals. Some people live as many as 20 years with the disease. Now, I've mentioned Alzheimer's disease progresses over time. Let's look a little closer at that progression in 3 stages. Stages of Alzheimer's disease can be measured as mild, some will call that early stage, moderate, which you may also hear as middle stage, and severe, and you might hear of that as late stage. Well, each stage brings new challenges. Let's take mild stage first. Besides memory loss, other common symptoms include trouble handling money, paying bills, repeating questions, taking longer to complete a normal daily task, and some of the personality and behavior changes. Most experience change in insight, and they may overestimate their abilities, which could place a person at risk for walking away with a good mission in mind, but they could get lost even in the early stage. It may be difficult to detect at first, but communication breakdown starts early, and it progresses over time. If we move into that moderate stage or the middle stage of Alzheimer's disease, well, memory loss and confusion just get worse, and people begin to have problems recognizing family and friends and understanding their time and place. Learning new things, carrying out steps in a task, and coping with new situations are all challenging. In addition, mood and behavior changes such as confusion, feeling suspicious and agitated are common feelings for people in the middle stage. Hallucinations, delusions, and a feeling paranoid can also happen frequently in this stage. As the person in moderate or middle stage struggles with personal care, they may want to do things for themselves, but they can't get the steps of the activity in the right order, or they can't figure out the mechanics of doing it with their body. Have you ever seen someone try to figure out how to get in a chair? Like, they might go in head first if they don't know how to move their body. Or have you seen somebody struggle to open a container? Maybe they don't know how to move the two sides of their body together. Or have you ever noticed somebody having trouble managing their clothing in the bathroom or the shower faucet, at the toilet, at the sink with a washcloth? All of this can be confusing if they lose that automatic body movement. So in the middle stage, body movements that once felt like automatic pilot just no longer flow smoothly. Incontinence is common during this stage as the person doesn't have the motor coordination just to get everything in the right place at the right time. Caregivers out there are nodding their heads if they've seen this struggle during self-care activities. And helping the person with those tasks is easier said than done, am I right? The caregiver's challenge is compounded because communication is more difficult in the moderate stage, as the person struggles to find their words and understand what they hear. Well, time marches on, and as a person moves into the late, severe stage of Alzheimer's disease, the brain continues to shrink. Communication is limited to only a few words or sounds. The person is completely dependent on the others for personal care. Near the end of the disease, the immune system is compromised, so frequent recurring infections are common. Eventually, brain changes are so extensive that individuals can no longer control their movements, and automatic functions like swallowing are compromised. I'm thinking of you and your friend at the kitchen table, and you're probably wondering, Heather, where's the good news? Well, the good news is this. Over years of research, people with dementia, families, and professional caregivers of all stripes have discovered effective strategies to improve life for people living with Alzheimer's disease and their caregivers. Many of the most effective home care strategies don't involve a medicine. After all, there's no magic pill to fix dementia. So we call these non-pharmacological approaches. For example, seeing the world from the perspective of those living with Alzheimer's disease helps us create days that are more meaningful, safe, and pleasant for everyone. While the days can be long, working with someone's remaining strengths, adjusting our own behavior, and modifying environments can help us create better days together. If you're caring for someone with dementia, consider these strategies. It's helpful to break down tasks into doable steps. One of the most common mistakes that I run into is when I see caregivers give too much information. I'm thinking of a caregiver who arrived to take her mom to an appointment. She greeted her mom in the living room and then proceeded to spill the whole day's agenda, like, Mom, it's good to see you. I'm glad you got your shoes on. It's raining outside, but I've got the car pulled around front. We'll take your walker just in case we have to park far from the door, but once we get to the doctor's office, they'll have a wheelchair. Are you ready to go? Well, imagine, of course, Mom probably says, You got it. No, I'm not going. It may seem unnatural at first to hold back some of the information, but breaking down the task into doable steps and putting those steps together may be the easiest way of getting out the door. Another strategy for creating better days is to follow a daily routine, but check it out, be ready to flex. Have you ever heard a caregiver say, We need to accomplish our work in the morning because after lunch, my husband likes to take a rest for a couple hours, read the paper, watch the news, help me with dinner, and we dine with the early birds. That's a couple who's figured out what works for them, and the predictable daily routine makes life easier for them both. When something unusual pops up, like an unpredictable chore or an evening outing that's like a special occasion, the caregiver knows that the man with dementia will find it difficult. So she allows for more time and anticipates that he'll need a little more help. That's the key. Build in the routine and lean on it when possible. But caregivers be ready to flex because people with dementia just aren't as flexible as they once were. Here are some more tips. Engage in familiar activities. Provide supervision for safety. For instance, secure medications or other potential safety hazards like guns. Communicate with empathy. That means focusing less on the facts, more on the feelings. A person with dementia can tell if you care about their problem or if you're sweeping it under the rug, because they can hear it in the tone of your voice and see it in your body language. So take a deep breath, listen to their concern, and use empathetic words to point out their feelings, like, "It sounds like you're missing your husband," or "I can tell you're looking for something," or "It seems like you're at the end of your rope." Once you've made an emotional connection and the person's listening to you, then you can redirect their attention by changing the subject. Changing locations and changing activities can also help shift the person's attention to something less upsetting. Redirection and distraction are proven effective strategies for managing challenging behavioral symptoms of dementia, but it takes practice. So don't give up. If your redirection doesn't work, just pause, listen some more, and try to make that emotional connection before you change the subject. A few more tips. Accept the person's reality. Try listening to some favorite music. Leverage their preserved skills. After all, it's still a use it or lose it proposition. Look around the environment. Are there things in the environment that are making it harder for the person to understand the situation? I've noticed some of my clients have trouble interpreting what they see in the mirror, for example. They don't recognize their own reflection, or they don't recognize the caregiver's reflection. So it seems like there are more people in the house. Have you ever heard someone say, "All these people keep coming in here," or "There's all these people moving around through here"? The same problem can happen at the window. At nighttime, when windows are like more reflective, the person with dementia may say, "People are outside looking in here on me." It's his own reflection in the window, but he doesn't recognize it. If you notice that, consider covering the windows before it gets dark, or removing or covering the mirrors if they're more confusing. Give the person more time to think and speak. Use visual aids to provide cues. Encourage exercise, such as getting out, going for a walk if possible. Because Alzheimer's disease impacts memory, reasoning, judgment, avoiding some things can make days better for the person and their caregivers. For instance, try to avoid arguing. Caregivers, have you ever heard this phrase, "You can be right or you can be happy"? It means letting some things go for the sake of keeping the peace. Now, I know it's hard to do sometimes, especially with our closest loved ones. I've always said, if you can't argue with your spouse, who can you argue with? But I know that if my spouse could no longer reason the way he or she used to, then our arguments over the facts will end in a stalemate. Have you ever felt the person with dementia pushing you into an argument? You know, they're upset about something that you know to be untrue, so you push back. Have you noticed that as long as you're willing to push, so can they to push? That's, my friends, is a stalemate. And it has more to do with the feeling of needing to be heard and wanting to be right. In this situation, there's only one person who can stop pushing. It's the person with a healthy brain. Caregivers, when you find yourself in a stalemate, and we all will eventually, my best advice is simple. Take a deep breath and stop pushing. Correcting the person with Alzheimer's disease can easily lead to an argument, but, we're not all that different. Who likes to be made to feel stupid? I mean, none of us like that. So practice some alternative approaches that don't say to the person, you're wrong. You might say, try this, and then show the person a better way. Or ask the person for their help and show them the correct first step. It all feels better than saying, that's not right. Avoid startling the person. After all, when understanding the situation is difficult for the person with Alzheimer's disease, they can seem a little on edge or they're easily startled. Everything will be easier for you both if you can avoid scaring the pants off of people in the beginning of your interaction. Practice approaching the person from the front. Let them see you before you're in their personal space. Offer your hand to greet the person or show your open arms just to invite a hug. It's a more comfortable and safer way of beginning the interaction than swooping in from the side or from behind. Don't expect the person to do all they used to, or at least not the way they used to do it. Shifting your expectations can go a long way towards settling into a new normal. And finally, don't expect to do everything yourself. Caregiving is a team sport, so find your teammates.
Thank you, Dr. McKay, for sharing best practice strategies to support individuals diagnosed with Alzheimer's disease. As you mentioned, people living with Alzheimer's have unique needs that evolve over time. For professional caregivers and aging services professionals, implementing person-centered care strategies as the disease progresses can help clients live at home as long as possible or help them feel at home no matter where they are. Listeners, visit ComForConnections.com to download complimentary resources, view show notes, and access all of our episodes. Don't forget to subscribe to our podcast on your favorite app. Thank you for listening and helping older adults live their best lives.